Hello, my name is Taylor Paraiso, and today I will be answering the question, how do I avoid running overuse injuries? Now, running overuse injuries can be detrimental not only to an endurance athlete's training routine and their running form, but also to their ability to perform everyday activities. Therefore, it is important to identify the risk factors associated with these injuries and work on combating them. So to start, some common running overuse injuries include plantar fasciitis, characterized by damage in the tissue that runs along the arch of the foot, shin splints, characterized by pain along the front of the shin bone, runner's knee, characterized by pain around the kneecap, and Achilles tendinitis, characterized by damage to the tendon connecting the calf muscle to the heel bone. So now let's discuss some terminology. The sarcomere is the functional unit of a muscle fiber, also called the myofibril. It is composed of myosin, which moves along the actin during a contraction, the H zone, the M line, and the Z line, or the Z disc, which anchor the actin to the sarcomere. Isometric contractions are contractions of the muscle wherein there is force generated. However, there is no change in muscle length. An example of this is pushing against the wall. So, how do we avoid running overuse injuries? Well, the study Skeletal Muscle Injury and Repair in Marathon Runners After Competition found that within 48 hours post-competition of a 26.3-mile marathon, the sarcomere biopsies of 40 male marathon runners showed myofibrillar lysis and disappearance of the sarcoplasmic reticulum. The authors found that the accumulation of microtrauma in the individual sarcoplasmic units was due to continuing activity even after total depletion of intracellular substrate stores, such as glycogen and lipid. In addition to that, the study Association between Knee and Hip Extensor Strength and Running-Related Injury Biomechanics in Collegiate Distance Runners found that while maximum voluntary isometric contractions showed no effect on injury prevention for 26 male and 10 female collegiate distance runners, improving the ability of the hip muscles to produce force via strength training, specifically the 1 repetition maximum back squat, increase the capacity of the connective tissue to bear mechanical loads, and ultimately prevented injury. Therefore, we avoid running overuse injuries by avoiding overexertion during training. This is done by increasing speed and distance slowly over time and supplying the body with proper nutrition to prevent the total depletion of energy substrates. And cross-training by strength training the lower muscles, particularly the hip extensor muscles, which include the gluteus maximus and the hamstrings. So, follow these guidelines and you'll be one step closer to a safe running experience. Thank you.